Let's start. So let me introduce myself. My name's Gideon Taylor. I have the tremendous honor to serve as Executive Vice President and CEO of the Jewish Community Relations Council of New York, or JCRC. I started in July and have had an opportunity to engage with some of you individually. Hopefully, I will get a chance, for those of you I haven't spent time with yet, to get a chance to talk and to meet, and hopefully in person. So as many of you know, JCRC is the primary community arm of the organized Jewish community here in New York. And our mission is to build relationships with local leaders, our different communities, to advance the well-being of our community in New York and all New Yorkers. I want to thank you all for joining today for what I think is an incredibly important briefing. I think, as you know from the invitation that I sent out, and I see here in front on the screens here a range of Jewish leaders from across the different spectrum of Jewish religious life, political life, really from a lot of different backgrounds coming together. I think it speaks to the importance of this issue as being one that affects all of us from across the different parts of the Jewish community, and all of us as New Yorkers. The issue that we're discussing today is a difficult one, a complicated one, and somewhat controversial one. And we thought, and I heard had the advantage of hearing Dr. Easterling speak to a group of religious leaders. And I was particularly taken with one comment that he made in particular, which was that were it not for COVID, the addiction crisis would be the top medical issue in New York City that we would all be talking about. And I certainly felt that there's this huge issue that's out there. There are these new approaches that are happening. And despite the fact that COVID is so all-consuming, this is something we need to be aware of and to focus on. And Dr. Torian Easterling very kindly agreed to address Jewish leaders in New York so that we can understand this new approach the city is taking, and to respond to questions and comments about the program. Dr. Easterling is the first Deputy Commissioner and Chief Equity Officer at the New York City Department of Health and Mental Hygiene. He's very well known, I think, to many of us from his frequent public service announcements on television, speaking very eloquently and urging New Yorkers to get vaccinated against COVID, and also many other key health issues. JCRC has had the fortune to work with Dr. Easterling on a number of issues, and we honored him with our annual Martin Luther King Award last year for his work in addressing healthcare disparities, particularly those exacerbated by the pandemic. And we truly appreciate, Dr. Easterling, all that you do and our partnership with you on issues that are such concern to the Jewish community and to our wider community. I'm going to turn it over to Dr. Easterling, and we're going to take some questions and comments, so people can send questions through the chat, I think, or through the Q&A. I think either. Let us know, and we will try and take some of those questions after Dr. Easterling sort of outlines the issue and this new approach of the community. So thank you, Doctor.
Gideon, thank you so much. It's a pleasure to see you again. Pleasure to see so many friends joining us this afternoon to talk about this really important issue. As Gideon has already mentioned, again, my name is Dr. Torian Easterling, and I am the first Deputy Commissioner and Chief Equity Officer at the Department of Health. And this is a really important topic. And no, we're not talking about COVID-19, but that remains a priority. But we're talking about something just as important. And so what we're going to do is walk through a few slides, and then we'll open it up to questions. And so first, let me turn to my colleague who I've leaned on so much during these last few years, Chelsea Cipriano, to introduce herself.
Hi, everyone. Thank you so much for having us. And thank you for the partnership. Honestly, the for many years and throughout COVID-19. I know it's been a really, really hard 2 years. We are here today to talk to you about this very important topic. My colleague Jackie Riley is also on with us. I'm going to start a deck that we will go through, and we will answer questions. If there are questions not about OPCs, but about COVID-19, you also have the right team here, so we're happy to answer those as well at the end. But we're going to dive into the deck, and if you will bear with me for just one moment, I will pull it up on the screen. Thank you so much.
Thanks, Chelsea. Before we jump into more about overdose prevention centers, what we first want to do is just start with the data. And I think you've heard us talk about it as an agency, but more specifically our commissioner, that nothing drives us more than data. And certainly that allows us to hit all of our other values, both equity and compassion. And I just want to also just really lean on this compassion, because this is why I got into this field in the first place, to suffer with and have empathy, to make sure that we are addressing, some of the biggest issues around our shared humanity. And what you're seeing right here in our data is that, as Gideon has already mentioned, if we weren't dealing with COVID-19, the pandemic, the epidemic that will be on our hands and our focus would be overdose deaths. And what we have seen in New York City is that this is the deadliest year to date for the overdose crisis. And our team has really been looking at this data for years. Happy to share the link, how we are tracking this. But I think it's important for us to start with the data, but also understanding that these are the lives of New Yorkers. These are people that we have probably seen around in neighborhoods. These are people who someone may know, whether it's an aunt or uncle or brother. And so I think it's important for us to start here and acknowledge that we have work to do to really save the lives of New Yorkers, and this is a really critical issue. On the next slide, you'll see how we have been able to disaggregate the data by neighborhood. You know that we really focus in and look at neighborhoods, also disaggregate by race and ethnicity, so we can really understand by population where the issues are. And you'll see here that the rates are highest in the Bronx and also in Harlem. And so places like Hunts Point, also in Tremont. These are the areas on the map where rates of overdose death are exceeding the New York City average. And those are the darker areas. And that's where we really wanted to focus our efforts. But we know that this is a global problem across the city. And I think every life that is lost certainly is a tragedy. And I think we can certainly start from that really, really critical point. On the next slide, now you have a sense of our data. And we can talk a little bit about our strategies. And we're not starting from scratch. Yes, we are moving forward with this very innovative model in our overdose prevention center. But this isn't the ways in which we have really been just leaning in. There have been a number of different strategies where we have really supported with syringe service programs, where we are making sure that we are addressing syringe litter, having our staff go out in parks, in neighborhoods, picking up these services, picking up the syringes, but then also working with our healthcare providers, not only for methadone delivery, but also buprenorphine as well, which are all our critical harm reduction strategies. And that's why we are now expanding to include overdose prevention centers. So as you know, on November 30th, we announced the first publicly recognized overdose prevention center in the US, now operating in East Harlem and Washington Heights. And so you'll note that the language here is supervised injection, but we're also using overdose prevention centers because we really want people to understand what's happening here in these programs. Yes, they are catering to individuals and the drug of choice that they choose, but this is so much more than just using drugs. We're talking about creating safe places, hygienic places where individuals can use drugs, but also get connected to healthcare services, be provided on educational services, also get connected to drug treatment. we have seen the benefits of overdose prevention centers. And I think that's also why this is a very important model that we pay close attention to. And this is just right here, an overview of what OPCs are. The picture here is not the actual center here in New York City. This is actually a site that is actually in Vancouver. And we've been doing a lot of engagement with other jurisdictions to understand what they're seeing as well. Next slide. I think the title here says it all. Science supports the benefits of overdose prevention centers, reduce overdose deaths in the neighborhood. We have already seen with the opening of our East Harlem and Washington Heights site that we have averted over 50 potential overdose deaths by just these sites alone. Being able to respond quickly and to inject naloxone, that has already happened in both sites. We know that overdose prevention centers reduce public drug injections and syringe litter. As I've already mentioned, this has already been a part of our arsenal as well. This also, OPCs has been shown to reduce drug-related crime, does not increase serious crime. Drug sales are not permitted inside or around overdose prevention centers. We know that the centers serve participants who are not in contact with other essential health services. These are relationships that have been in place with the provider, and really important that we continue to maintain these relationships as well. Next slide. OPCs work worldwide. Already alluded to the work that's happening in Vancouver. There are over 60 jurisdictions that have successfully implemented over 100 overdose prevention centers. The data has not just started. When we opened, we're seeing over 30 years of evidence that show that OPCs are working, and we are even looking at our data from the 2 sites that we have open now. As I've already mentioned, over 50 deaths have been averted. And we know that OPCs save lives. Most recently in our December Board of Health meeting, the Board of Health has issued a statement making sure that we take action to expand on our harm reduction services, preventing overdose deaths. And we're certainly urging both the federal government and New York State to really support OPCs and other harm reduction services. Next slide. And so I'll just end here, certainly with, grounding us in how important, the work that we do is really about preventing death, ensuring equity, and really making sure that we are doing this all with compassion. We know that OPCs save lives. We have seen the improvement of health as well, and these are the things that we continue to focus on. You've already touched on that we have to think about the individuals, many of the lives that have already been lost. And I think this also gives us hope because we know that this has been a long-standing issue in our communities across New York City. And I think this is why we want to continue to hear from you about how we can message it, answer your concerns as well. But I think it's really important that we all have the same message on what OPCs are able to do in New York City. So with that, I will pause and turn it back to Gideon for any discussion.
Great, thank you. Thank you very much. So there's a couple of questions I see have come in, and I encourage anyone else who has any specific questions to just put them in the chat. So I guess the first question I think that's on many people's minds is where does this go? So there's obviously these 2 sites. What do you see as the future in terms of what the need is in New York, and how do you see that playing out in the community? Geographically where, and how many sites would ideally there be in your view?
Yeah, so I cannot answer on the number. I think just the third slide that we have showed shows the breakdown disaggregated by neighborhood, and so certainly we know that the need is great. It's not just in East Harlem and Washington Heights. We see it already in Tremont, Hunts Point. We see this as an issue in Brooklyn. And so the data is going to guide us. And it's going to guide us to make sure that we're having the right conversations with providers. These are existing providers. These providers have been doing the work for decades. They've been providing syringe services, exchange. They've been providing other acute care services. Clinicians been on site. And so we want to make sure that the providers that we are working with have the rapport and relationship with the neighborhoods that they're in, that they're really suited to be able to manage this type of service. So I cannot say for sure where that next site will be. But the data is showing us that we need to be in those areas where we're already seeing high rates of overdose deaths. And as I mentioned, Bronx is one borough as well as Brooklyn. And so I think that's where we're going to continue to explore further, and those discussions are continuing.
So maybe you can share with us some of the pushback. There's obviously some folks don't see this as positive, and you alluded a little bit to it. Maybe just talk a little bit more about what you see as the arguments, the criticism that's come, and how you respond to it. Maybe just give us a sense of that. I think be helpful to understand, because this is obviously not something that's simple or straightforward. It's very new, it's innovative, and that makes it more complicated. Maybe you can share some of that discussion that you've had and engagement you've had with people in the community who are concerned about these sites.
Yeah, certainly. And I think it was really important that we do a lot of engagement, in neighborhoods. And so our former executive deputy commissioner, Dr. Chinazo Cunningham, when she was here at the health department, was really leading a lot of our outreach to community partners, to community boards, elected officials. And we're so happy now to have Dr. Cunningham in a very important role at the state, at OASIS, making sure that Dr. Cunningham is continuing to advocate for this. I will just highlight some of the issues and questions that have come up. Will OPCs be the place for new drug users to use drugs? How are we preventing selling of drugs nearby OPCs? Are they going to draw people to the neighborhood just to use drugs? I mean, I think it's really important that we start from the beginning, that these are existing providers. They've been in the neighborhoods longer than I have been at this health department, longer than many of our services have been in place, and they have the relationships. And those relationships are people who live in the neighborhood. So when we talk about this data, we're talking about individuals who are dying based on the last known residents. And so that means that when we're showing this data, we are really talking about neighborhood residents. And so we know that these relationships are important. We know that the existing services are important, and they expanded it. And so that's important to really make clear. These providers were never selling drugs to begin with. They were already providing really critical services, and they were really taking care of individuals that were already in the neighborhood. And so this idea that people are coming far and wide just to use drugs, we've already seen from the data that majority of people are residents nearby. So that's really important. The other thing that we often hear is about the oversaturation of services in neighborhoods. This is a new model, and we're talking about harm reduction services that we've been hearing from advocates, community partners. And so this is an opportunity for us to really have a different conversation. We know that there are methadone clinics. We know that there are providers who are prescribing buprenorphine. These are also really critical services as well in the fight against opioid overdose death. And so we certainly need to be looking at more holistically, how are we providing an array of services for neighborhoods? But I know that has been a sore point for residents to think about, well, are we oversaturating in one neighborhood versus the other? And I think that conversation will certainly continue. And I think the other thing is, this idea that that we are bringing, drug sales up in the neighborhood, as I mentioned, is not permitted on site, and certainly not permitted in the area. So that those are just some of the things. And Chelsea, I don't know if you wanted to jump in and add any other key points.
Yeah, no, I appreciate that, Dr. I think you hit all of the high points. I think we've heard some concerns about like what is actually happening inside of the facilities. I think people have maybe some preconceived notions about what it may look like or what it may feel like in there. I think we've had great success with folks seeing these photos and seeing that they're really clinical and very hygienic and very clean services, and understanding kind of how they work, and if someone comes in with their own substances to use, what the people inside, the experts inside, are there to do, and really just explaining it. We often have, when we go to community board meetings and other meetings, the providers themselves, Dr. E has said it a couple of times, these are not run by the city, they're private providers. So providers who have done this work for a long time and are now adding this additional service to the work that they already do with clients that they've known for a long time. So I think hearing also from the providers has been really helpful in explaining what happens when a client comes in, how both they are assisted and observed throughout to ensure a safe use, but also helped if they need assistance, if there's a reversal that's needed, and also connected to services. I think these facilities have, like Dr. E was saying, a multitude of other services, including healthcare, vaccination clinic, pharmacy, showers, connections to housing services, a real array of things. And that's why we really push back on the language of syringe and, a supervised injection facility in lieu of OPC, overdose prevention, because it is so much more than that. I think the last thing that we hear a lot about is, as Dr. E was saying, is the oversaturation and methadone clinic comments. And I think there was some confusion in the beginning that these were additional methadone clinics, which they're not, they're different. But the Board of Health statement that was made recently by the New York City Board of Health. For those who don't know, the Board of Health is an independent body of experts that advises and takes action for public health in New York City in partnership with the agency. And their statement included some pretty strong calls to the federal and state government about making access to treatment, methadone, buprenorphine, things, treatment options more accessible so that they don't need to be accessed just, at these locations, but potentially via telehealth and other options like that. So we'll make sure that that's in the chat so you can see those calls to actions, because they're really powerful and will address some of the bigger issues that we know the community feels and sees every day in their lives. So thank you. I think those are the key points.
Great, thanks. So one of the questions I see here asks about, and you touched upon a little bit about the overlap with other vulnerabilities. So how does the people coming to the centers or who would use these centers, how does that tie with other vulnerabilities that this population has?
Just vulnerabilities as far as other health issues?
I think both. I mean, certainly health issues and in general.
Yeah, I think that this is a really key benefit of working with an existing provider, knows a lot about the neighborhoods, knows a lot about what's going on with individuals in the area, and the type of people who work, people with lived experience who previously had used drugs. And so there's a lot of connections with supportive housing. We also have connections into healthcare systems that are nearby. And that really allows us to support, or not us, but the provider to support the individuals that are coming in. In addition, the other existing services that were present. So, raising awareness of fentanyl in drugs. We know that the provider has already been doing this. So using fentanyl test strips, making sure that they are addressing these other key issues as well, I think is important to note.
And maybe just a little more, you talked a little bit about what other services do, to what extent are the centers a one-stop shop for wider social services, and is that how significant, and as you see these growing and expanding, how do you see this approach as relating to wider social service needs for the population, and how that would impact the local community, the wider community? Obviously, many of the people on this call are living in communities where sites may ultimately be located. And I think sort of important, interesting for us to know, how does this sort of fit into the wider context of social service and need and treatment and provision of services in the city and in those neighborhoods in particular?
Yeah, I think a key part already that we have seen, and I mentioned as far as a benefit, is that it does reduce some of the public drug use and some of those public issues that we already know exist, right? Individuals walking into a McDonald's or to a gas station or a bathroom and just using drugs, or they're using it in the alleyway. So I think that's really important. I certainly hear you on the point of just being able to track a little bit better around, what those linkages of services, how does that really impact some of the long-term issues? We do know, having sort of a immediate connection to our health and hospital system, to be able to have access into, direct access to inpatient services, outpatient services, also to psychiatric services as well, is already linked through these providers. And so that I think as we have moved forward and really look at the data, these are some of the things that we're going to be looking at really closely. The third thing I'll mention, and as part of the operations, we have already, as an agency, been working with our colleagues in DHS, PD, to do joint operations and to really do neighborhood scans. What are some of the other environmental issues that we need to address? Syringe litter, making sure that individuals are getting connected to some of the DHS shelters, or making direct connections to supportive housing. So as we have seen with our joint operations, we've really been able to make direct connections to the type of services that individuals need. And these are just some of the ways that we can sort of do wraparound services in addition to our overdose prevention centers.
Great, thank you. So if we can just turn it for just before we close to what I guess is the number one issue on our minds, COVID. So maybe you can just sort of give us some of your sense of where we're at in New York. There was one specific question was asked, which was, is the availability of tests, of antigen tests, and how difficult it is to get hold of tests. That was one specific question. And just generally, how do you see where we are at in this wave, and what wisdom can you share with us as we all try and navigate these difficult times?
No, it's a really, really important question. And I know that it's top of mind for so many of us. And I do not have to state the obvious, but I will, that I know that it's been challenging. We've all been through the trenches, the ways in which JCRC and so many other organizations have been working side by side with us, making sure that we've been getting out the message. How do we protect ourselves? Helping people get connected to testing, making sure that we're getting vaccines out. And so I just want to say thank you again for your ongoing work, not only for the Jewish community, but also I know that the work you do across New York City to support all communities. And I think we have to continue this effort. We cannot take our foot off the gas. The reality is that Omicron has threw us for a loop. And it may feel like this is a deja vu moment. I can certainly say that we are seeing increases in cases, certainly more than we have seen previously. But there's a caveat there. We did not have the same testing infrastructure during the first wave. And so in March 2020, we were primarily testing in the hospital. And so we are certainly seeing more cases than we've ever seen, more cases than we ever seen per day, and definitely over a 7-day average. But the thing is that this is not truly a deja vu moment. What is different is that we have a very high vaccination rate. And I just want to say thank you again for all the work that you all been doing to really get the message out. We over 6 million New Yorkers who are fully vaccinated. We don't get there without the collective effort that you've all been contributing to. Over 2 million additional doses or boosters. And we're really getting the word out of how important it is that folks get boosted. We still need to really make sure that we're taking care of our elders. And I think that this was a really important point that I really remember in some of the smaller meetings with some of the physicians from the Jewish community about how are we taking care of our most vulnerable. When we look at our 65 and older, only about 55% have received their booster. So we need to do more to make sure that we're taking care of our elders. This is a really key point. And the data has been clear from UK that the boosters are effective against the Omicron variant. And so we're gonna make sure that we are, really getting the message out that we want folks to get their first dose if they haven't already. It's really important to get boosted because we know that it's effective against the UK variant. We expect that we're going to see more cases. We're not out of the woods yet. But the good thing is from the data that we're seeing from the UK and South Africa is that it does look like the Omicron variant will present more milder infections than say Delta or even the ancestral strain. But here's the issue. When we're seeing 30, 40,000 cases over a 7-day average, the problem is that even a small percentage of that will put a strain on our hospitals. We're already starting to see increases in hospitalizations. And we're talking about a vertical trend upward in hospitalizations. And so this is what concerns us. Certainly not just about severe infections, but hospitalizations. And those hospitalizations are layered on with the individuals who have delayed their healthcare services. So individuals who may not have been treated for their diabetes or their cardiovascular disease or other kidney issues or chronic issues that have been longstanding. And so this is why we need to make sure that everyone is doing their part, continues to do their part. I know that fatigue is setting in. And it's really important that we just put out the message. The other things that work include testing as well as masks. And I know that there is a clamor right now for the rapid at-home test kits. One thing that we are working on, first, kudos to our colleagues at Test and Trace, who've done so much to expand on our testing infrastructure. We are working, they are working every day to expand and bring on more testing units, and expect to hear more announcements about how Test and Trace is going to expand the number of mobile units that will be available to New Yorkers. In addition, we talked about how important it is to get our at-home test kits out, and this has been really key. We've been supporting our schools, and we really do hope to continue to work with our community-based organizations to get more test kits out into the communities that we know need them most. And so as we work with the state, our federal partners to procure more tests, more information will come available about how those test kits will be made available for New Yorkers. And so I think these are all the key points. Mayor Adams, has really talked about the 6-point plan. One, making sure that our vaccines are available to all New Yorkers. As I mentioned, testing really important, and we continue to expand on our capacity. Treatment, also another key area. The treatment as it relates to both sotrovimab, the monoclonal antibody, which we are working with the state to make sure all of our healthcare systems have access to it, but then also our antiviral. And with the release, the FDA approval of Paxlovid, we are making sure that we're working with our healthcare partners. And we're seeing wide use across New York City in all 5 boroughs that providers are prescribing Paxlovid, particularly for individuals who are being identified very early on with symptoms and are vaccinated. So these are really key areas. The other key areas include slowing the spread. So the work that we're doing to make sure that guidance is clear, our messaging is clear as well. In addition, as I already mentioned, making sure that we continue to have the safest schools ever. And you know that we are increasing our testing surveillance. We're making sure that at-home test kits are available as well, in addition to all the other layers of prevention. And so these are just some of the key things that we're going to continue to do, and we're going to do this in partnership with you all.
Well, thank you. So before we close, two questions. Want to just turn briefly back to the original topic of the sites. One question that came in was, is the DOH taking input from local community boards about potential locations?
We're certainly engaging and working with community boards. As I mentioned earlier, I think it's going to be really important to identify the right type of providers. But what I will say to, as far as community boards, we certainly want to do, the same type of presentation, making sure that we're answering questions, we're making ourselves available. And so let's definitely make the connection so that we can present to the community board.
Terrific. And last question. If anyone on the call or anyone who watches this subsequently, we'll make it available for those who couldn't join. If people want to bring this presentation or some kind of presentation to have some discussion in their community or in their venue or organization, presumably we can help connect them with you in your office to find a way to take, not to draw on your time, but certainly to draw from your team's time to do that. How should we do that? And is that possible?
Oh, absolutely. Absolutely. I'll take it to Chelsea to share a little bit more, but please reach out to us.
Yeah, no, thank you, Dr. E. We are happy to do this roadshow and discussion, right? Because the discussion is the really important part to pretty much whomever, wherever. We're doing a lot of community boards right now. To your question earlier, Gideon, I think hearing from the community boards and answering their questions and helping them speak to community members, just like we're doing with you all, is really, really helpful, particularly to help folks understand that the city isn't citing these locations. These are existing providers. So we aren't going out and opening new locations in communities as the city. These are private providers doing this as part of their existing work. Has been really powerful in helping understand what's going on. And we're happy to do it and happy to continue answering these questions. So the best way to do that, I think, Noam has been so helpful in setting this up with us. I am happy to help be that connection. If folks do want presentations, we have many other experts of the health department who have been doing these presentations. So it may not be Dr. E, but we are out there doing this however we can. I'll also just really quickly, a last note, I dropped an FAQ into the chat. This is back to COVID, but we're getting a lot of questions about, if I test positive at home, what do I do? Because that's obviously different than testing positive through, a testing site or a doctor's office. And I think that having the tools to know the first thing you need to do when you test positive, or if you test positive, is to isolate, is to stay home. Stay home if you're sick. We're not very good at this as New Yorkers, but we've gotten better over the last 2 years. Stay home and get connected to services. The number for services, if people need them, free hotels, free meal delivery, free dog walkers, is 212-COVID-19. So whenever anyone asks me, like, what do I do when I test positive? Those are the two most important things to do. And then let folks know that you've been in touch with lately, know that you've tested positive and that they should get tested. Those are our key things. Anyone can do them, very simple steps, but I dropped that FAQ into the chat so folks have it.
Great. Well, thank you. And I think that your engagement with community, with us today, you have here a group of people, each of whom have communities and leaders. These are a group of leaders and some religious figures from the community is so helpful. And I think engagement with the community board is important. Someone made a comment in the chat, not only important to have discussion about the providers, but also the locations. And having that, and clearly the community input is one we really welcome so much. And I just really want to close by a big personal thank you to you, Chelsea, and to you, Dr. Easterling. Torian, you're really a figure who's just done so much for our city. You're our Dr. Fauci and other things all rolled into one. And, you know, we certainly feel such a sense of confidence that you have a vision for addressing so many of these issues. And I know I speak for JCRC, and I know I speak for the leadership of the community on this call, that we look forward to engaging with you, to working with you for all you're doing to make New York a safer and a healthier place for all of us. So a big thank you. We wish you much success, and we look forward to continuing to work together. And thank you, everyone, for joining us today. I think this was maybe a first in a series of what we want to do, of making sure that we're bringing to the wider community cutting edge issues that are really the issues of the day. And this is clearly one of them. And it's wonderful to have an opportunity to have your input, Torian. Thank you. Thank you, everyone. Wishing everyone a good day. Thank you.